starting with the second lecture on asphyxia. In the previous lecture, we discussed the general aspects about asphyxia, and in forensic medicine, as we discussed, that we are concerned mainly with the mechanical interference with the respiration, anatomy of neck, just a revision that we know that there are important structures in the neck and slightest pressure can lead to their interference. And the most superficial they are the carotid bodies, and just a slap, a slight pressure can lead to excitation of the carotid bodies and cardiac standstill. And the carotid sinus and the vagus nerve, they are the most superficial structures which are excited by slightest pressure on the neck. Then the venous return can be occluded. The superficial veins, the jugular veins, they are compressed by very little pressure. Then the carotid vessels, the arterial supply to the brain is mainly through the carotid arteries, and when it is compressed, there will be interference with the arterial supply to the brain, and that will cause anoxia. Then the arterial supply, we know, also is continued through the vertebral vessels. Vertebral vessels are traveling through the vertebral foramina, and it needs more force to occlude them. So these are the most important structures in the neck. When they are interfered, the interference with those vital structures and will be responsible for the gross consequences. Then the windpipe. Windpipe is a rigid structure, cartilaginous, and that can be compressed with force, and it will interference with the transfer of air to the lungs, and that will be causing hypoxia or anoxia. And as they are hard and rigid, enormous pressure will be required to occlude them. And the mechanism, usually it is that the larynx is pushed upwards and backwards against the posterior pharyngeal wall. The base of the tongue is pressed up and back toward the posterior pharyngeal wall, and which occludes the respiratory passages posteriorly, and hence the air will not be entering into the lungs. So that is the normal mechanism in throttling, in hanging, and in strangulation even. Whereas direct pressure on the larynx needs much more force, being a rigid structure. Now, regarding the force and amount of pressure which is required, for example, we know the carotid sinus, they are more superficial, and the slightest pressure will be leading to excitation of the vagus nerve. And the jugular vein just need 2 kgs of the pressure, and the carotid arteries about 5 kgs, and airways need a 15 kg, whereas the vertebral arteries which are traveling into the vertebral foramen, that requires 30 kg. And naturally the human body weight is much more than these pressures or weights which is required to compress them. Now the amount of tension which is required in kgs and pounds for jugular vein 2 kgs and 4.4 pounds. Similarly the carotid, the trachea and the vertebral. So this is the amount of tension by the weight which is pulling them. So the greatest amount of pressure which will occlude all the structures, that is approximately 20 to 40 kg. Now the next important phenomena is the fracture of hyoid bone. The hyoid bone is basically a cartilaginous structure, and this is important when it is ossified, and usually it ossifies after the age of 40, and its fracture will be giving an idea how the pressure to the neck has been applied. And basically two mechanisms are applied. The first one is the direct lateral compression, which is with the manual throttling. Direct lateral pressure, and with this pressure the fractured ends will be moving inwards. Direct lateral compression in manual throttling, that will be displacing the fractured ends inwards, whereas the other mechanism is indirect pressure, which is in hanging, the upward and backward pull. Because of the suspension of the body, there is upward and backward pull, and in this now the fractured end will be displaced outward. So these two phenomena, the first one is direct lateral compression squeezing inwards, and the fractured ends will be displaced inwards, whereas in hanging there is upward and backward push with the weight of the body, and the fractured end will be displaced outwards. So the lateral compression is the manual strangulation, and indirect is in hanging. In manual strangulation, the fractured ends will be displaced inwards, whereas in hanging they will be displaced outwards. And usually it is seen after the age of 40 when it has been ossified. This is showing the inward displacement. Now again, starting the specific asphyxial deaths. In mechanical asphyxia, the most important occlusion from outside and occlusion from within. From outside, it can be suffocation, which is with the smoothing or overlaying, hanging and strangulation, stampede or traumatic asphyxia, which is obstruction to the movement of the chest, and then a special type which is autoerotic asphyxia. Then occlusion from within can be choking, gagging and drowning. This is occlusion from within the lumen of respiratory passages. And the interference at the level of neck can be hanging, can be strangulation, can be manual throttling, and this can be also various mechanisms garroting, throttling manual, mugging with the elbow, and Bansdola with the sticks. Now starting with the first specific mechanical interference to the respiration, the asphyxial death is suffocation. Suffocation is a form of asphyxial death in which the entry of air is interfered with at the level of respiratory orifices. Suffocation is mechanical interference to the entry of air into the respiratory passages at the level of mouth and nose, or the respiratory orifices, other than constriction of neck and drowning. So the entry of air is interfered at the level of nose and mouth. And this is called as the purest form of asphyxia, because complete obstruction to the entry of air through the respiratory orifices is led with this form of asphyxial death. It causes immediate unconsciousness, immediate loss of power, and death. So it is so advances so quickly that there is immediate loss of power, unconsciousness, and death. And it is said as a painless form of asphyxial death. Now, this can be either smothering or overlaying. Smothering means when you obstruct the entry of air either by gagging, by choking, or by barking. This is a special phenomena. So smothering is either by gag, by choke, or by barking. So the entry of air into the respiratory passages through mouth and nostril is interfered with gag, choke, or barking. Barking is special phenomena. Now smothering is when we block the air passages, that is the nose and the mouth, with hand, with any other material. The entry of air into the respiratory passages will be interfered with by obstructing the air passages either with hand or with any other soft material. Whereas overlaying is usually the victims are small children, and the overlaying is by the mothers themselves overlaying on the neonates or any person sleeping by side of the kid and overlays. So these two form, the smothering and overlaying, they are the form of asphyxial death where the entry of air into the respiratory passages is occluded at nose and mouth level. And the occurrence, either it is accidental, suicidal, and homicidal, we'll discuss. Usually it is accidental. Most common is accidental overlaying. Or sometimes the epileptics or the alcoholics they bury their own face during the fit or during the drunkenness into the pillow, and they get suffocated. Suicidal is uncommon, and homicidal, it is not possible in adults, but if they are incapacitated by intoxication or by overpowering or by any other means, then it is possible. The mechanism of death is either hypoxic hypoxia, that is the reduced entry of oxygen leading to hypoxia, hypoxic hypoxia, or anoxic anoxia, complete blockage. So either it is hypoxic hypoxia or anoxic anoxia. Now smothering is a form of asphyxial death where the mechanics are involved, that we occlude the air passages with anything, with hand, piece of cloth, plastic bag, or any other material. Then the autopsy finding, there will be specific autopsy finding around the nose and mouth. There will be abrasion, there will be bruises around the nose and mouth, and we should try to look inside the lips. There will be bruising on inner side of the lips, on the gums. So these specific finding will be at the respiratory passages around the nose and mouth. So there will be abrasion and bruises around the nose and mouth. But they can be absent if the material which is occluding the air passages, that is soft. And these injuries usually they are as a result of struggling, and the inside of the lips and the gums, they should be examined, but they can be missed. And there is usually blood tinged secretions, fluids within the respiratory passages. They are pathognomonic of struggle. The person was struggling, and there is intense congestion and bleeding which mix up with the mucous secretions and the respiratory passage. Then the non-specific findings which we have discussed, that is the cyanosis, congestion, petechial hemorrhages, and edema. They are present in all forms of asphyxial deaths. So non-specific finding will be also there, and specific finding at the locus where the interference is made. So the non-specific cyanosis, congestion, petechial hemorrhages, and the blood remains in fluid form. In all asphyxial death, we have discussed that the blood remains in fluid form, and this is because of release of fibrinolysin from the endothelium of the small vessels, and this is responsible for fluidity of the blood. Blood remains in fluid form. These are petechiae. Then smothering by plastic bags. This is common nowadays. Usually the children playing with the plastic bag, they cover up their face and they get suffocated because the moisture of the air, it clings to the face. With the moisture, the plastic material, it clings to the face, and they get suffocated, and it is not possible for them to remove it. And it contains a glue like material, and when you examine the blood, you will find that glue like plastic material within the blood, and that will tell that the person or the child was alive when he or she was inhaling. So smothering by plastic bag is common, and usually this is accidental, covering the face with the plastic bag, and the respiratory orifices, they get blocked. The medical legal aspect, usually they are accidental. And sometimes the babies, newborns, they are born with the meninges covered, covering their nose and mouth. This is called as cold death. That is, the baby is born with the meninges covering the face, that is the nose and the mouth, and they get asphyxiated, suffocated, and they die. That is called as cold death. Similarly, the alcoholics can bury their face, and the suffocation appears. Then the overlaying, this can be by the person who is sleeping by the side of a children, or even by the mother, and sometime it happens that the young inexperienced girls, they press too hard with the breasts, and the neonate gets suffocated, and there will be blockage of the nose and mouth, and the child will die. Or it can be with the hands, the mouth and nostrils, they are covered with the hands, and this is homicidal. Or this can be committed with the soft material like pillow, and this is commonest method of infanticide. Now, Burking. There were two criminals, Brooke and Hare, and these murderers, they invented this asphyxial phenomena. Usually the alcoholics at night, they were drunken, lying on the roadsides, and these two people, they used to asphyxiate them. One person used to sit on the chest and cover the nose and the mouth, and by sitting on the chest is unable to move, and secondly, by covering the nose and mouth, smoothing. With this, they used to drag the person like wheelbarrow, just to mimic, just to disguise that some road traffic accident or any other injury has occurred. And the objective was they used to sell these bodies to the Edinburgh Medical School, and they used to sell them, but later on they were caught, and they invented this method, and after their name it is called as Burking. And this is a mixed stampede, that the pressing the chest while sitting on the chest and blocking the air passages with the hand, smoothing. So they used to kill the victims and sell their bodies to Edinburgh Medical School, and sometimes they used to drag like a wheelbarrow, just to disguise, just to mimic a road traffic accident. And this is a mixed example of smoothing and traumatic asphyxia. Now the internal respiratory obstruction, that when the respiratory passages are obstructed from within, and this is either with the choking or gagging. Choking is when something accidentally enters into the respiratory passages, and that can be a fine particle of food or any other pebble or coin or anything. But in choking, the size of the object does not matter, because just touching to the vocal cord will excite intense vocal cord spasm and asphyxia will occur. Whereas gagging is when something is introduced and it is usually homicidal. Something is stuffed into the mouth, a piece of cloth, a handkerchief, which is stuffed into the mouth, pushing the base of the tongue against the posterior pharyngeal wall and occluding the respiratory passage. So, the occlusion from within, that is either by choking or by gagging. So, choking is a form of mechanical asphyxial death where there is occlusion of the respiratory passages by any solid object, and initially it excites intense coughing trying to get rid it off, but when this is unsuccessful, then choking results. And this is important, that the size of the object is not important. This is not necessary that the size of the object is sufficient to fill the internal respiratory passage. This is not the case. The size is not important, because intense vocal cord spasm, and this is the spasm, and asphyxia will occur. And this can also be in epileptics, in alcoholics, when they lie supine face upward, the tongue falling back against the posterior pharyngeal wall, hence the internal respiratory passages they are occluded and results in choking. And we can, if we can help someone, that is the Heimlich maneuver, and we all should know it. Heimlich maneuver is life saving. If someone is getting choked in front of you, with this simple procedure you can save the life. If it is a small neonatal child, just by proning, patting at the chest, and simple procedure, you can lift the child upside down, holding the legs and face is downward, and patting the chest, and the child will cough out the material which is being choked. And if it is an adult, you can come to the back of that person standing and just make a fist with one hand, press the chest. It should be so forceful that it should be pushing the chest upwards, backward and upward, and that will pushing violent air in outside the trachea, and the choking material will come out. This is how that you should get at the back, make a fist of one hand, hold it with the other, and just give a upward and backward pressure to the upper chest, and the object will come out. So this is a life saving, being a medical student, being a doctor, we should know, but everyone should know it. And this happens almost at every home. We should teach everyone. This simple procedure is life saving, usually to the children. And simple procedure जस्ट बाई, क्योंकि नियोनेट्स में ज़्यादा होता है, तो नियोनेट्स या चिल्ड्रन को जस्ट अपसाइड डाउन एंड पैट एट द बैक एंड यू विल save the life. And the cause of death in this case is either asphyxia or vagal inhibition, because just touching to the vocal cord will excite the vagus nerve and cardiac standstill, or sometime laryngeal spasm causing asphyxia. Now gagging is something is stuffed into the mouth, and this is the mechanical interference from within, that the entry of air into the nose and mouth is stopped, and this is how the gag is stuffed into. And it is usually a handkerchief, any piece of cloth which is stuffed into the mouth, and it not only fills the mouth but it also obstructs the respiratory tract by pushing the tongue backward. Initially, when the piece of cloth is stuffed into, a little respiration through the pores will continue. But as soon as the saliva, the mucous membrane will soak that piece of cloth, then the obstruction will occur. So when gag is packed, choking occurs as soon as the saliva, mucous membrane and the edema fluid moistens and obstructs the cloth. क्या हो रहा है इम्पोर्टेंट? आपको कह रहा हूं. So initially, through the small pores, the respiration will continue, but as soon as these pores are clogged up with the secretion, then the asphyxia will occur. And the autopsy finding in this, the tongue will be bitten because of the push of the piece of cloth. It will be rubbing against the teeth, and you should examine it. And in epileptics, the history, the tongue bite and the position of the tongue is pathognomonic, and the foreign body will be found in the respiratory passages. Now regarding the medical aspects, it can be accidental by impaction of anything, by impaction of fish bone, by impaction of denture or any other foreign body. That can be a coin, that can be a pea, that can be any rounded object. And similarly in alcoholics, they can inhale their vomitus. And in children, usually the pebbles, the marbles, the coins or pea. And these are various objects which were found at autopsy. They were recovered. This is a coin, this is a buckle. So choking is usually confined to the infanticide and or homicidal when they are overpowered by more than one individual. Suicidal is rare, and gagging is always homicidal. If something has been pushed into the mouth and the person has been tied, it is always homicidal. Then cafe coronary. Cafe, the cafe means the any restaurant or cafe. Coronary, that is heart attack. So this is an incident which appears to be a cardiac event which appears to be heart attack, but this is not cardiac event. This is choking, accidental choking. The person dining and suddenly aspirates any food particle, he will be unable to utter a voice for help. He or she will mimic on the table and will collapse. So it appears as that some coronary event has occurred, but it is not a coronary event, it is choking, accidental choking. So we should be aware what is happening around so that we can save some life. So cafe coronary is a condition of accidental choking where a bolus of food produces the obstruction of the larynx. And the victim just slump over the dining table with little or even no cry. He cannot even call for help. Just scum or slump over the table. And that is why it is called as cafe coronary, that it looks like a heart attack. And this is usually to the alcoholics having the suppressed their gag reflex, intoxicated, and death is due to excitation of the vagus nerve and cardiac arrest. And at autopsy, you will find the bolus of food or the material which has been impacted. So this was a case where a piece of meat was extracted from the respiratory passages. Then the entrapment. Children usually habit of playing hide and seek and lock themselves in the cupboards, and sometimes this leads to grave consequences. The person, when it is entrapped, initially the air is available, but later on, due to the reduction in the oxygen concentration, the person gets asphyxiated. Then positional asphyxia. You must have seen these pictures. The cop overpowering a person and just they are rotating the neck, tilting the neck, because it interferes with the entry of air into the respiratory passages, and this is called as positional asphyxia. By tilting the neck, you are kinking the trachea, you are interfering with the entry of air into the respiratory passages. In the wrestling, by arm lock or by any other means, you are inducing positional asphyxia. Just you can see this is a straight pipe, and when it is kinked in either way, it will obstruct. Person head moving back or forward will kink the respiratory passages and is common tie, which is hog tie bondage. This is tying of the forelimbs at the back, and the position is such that the person is unable to breathe because his weight is pressing down, chest is unable to move, and hands and feet, they are tied together. And this is hog tie bonding, tying of all the four limbs together at the person's back, and it typically involves this posture, but any other variation can be achieved. Then ball tie, and this is a tying of a person in ball shape or fetal position where the legs are pushed up and pressed against the chest, like this. This is a fetal position, that legs are positioned up, pressing against the chest, and the person is tied in this position and the chest is unable to move. This is ball tie or fetal position. Any question? Thank you very much.